Hello everybody and welcome to our September clinical webinar. Lovely to see you all. We just got a little trigger warning for you today. Due to the nature of the work we do, particularly on the Shout platform, we will be mentioning suicide, self-harm and eating disorders today. So it's completely within your gift if you feel you need to step away. Whatever you need to do to take care of yourselves is absolutely fine with us. And if you feel you need to talk to anybody after this webinar, please feel free to direct message and we can organise that for you. So AI and mental health, very, very hot topic at the moment. Constantly evolving, constantly seeing lots of different things in the press. We've been working on this webinar for, gosh, a few months, and every time we've met to talk about it, something else has come out. Some more research has been published. Something else has come out in the press. It is very controversial, and we really hope that you find today interesting and insightful. So I'm going to share my screen now with my presentation. Okay. So hopefully you can see that. So we'll start with some intros. My name's Amy. I'm a partnerships manager here at MHI. So myself and my team look after a huge range of partners between NHS ICBs to other charities, also corporate organisations who partner with us in some way, commissioning a product or a service with us. Fiona, did you want to introduce yourself?
Sure. Thanks, Amy. I'm Fiona. I'm the Senior Clinical Advisor at MHI. Obviously, that includes Shout and the Mix.
Thanks, Fiona. And Emilia?
Hi, I'm Emilia. I'm a machine learning engineer, and I'm part of the data insights team here at MHI.
Thanks, Emilia. And Melis?
Hi, everyone. My name is Melis, and I'm the head of data science and AI at MHI. Pleasure to see you all today.
Thank you, Melis. Okay, so just a little snapshot of what we're going to be sharing with you today. We have got loads to share, so we will try our very best to get through it all. I'm going to talk a little bit about MHI. We're going to cover the landscape and research when it comes to AI and mental health support. We're going to be exploring, can we entrust AI with our mental health? Is it possible to mimic human connection and empathy? We'll also talk about what Shout and the Mix provide that off-the-shelf generative AI cannot, and how we're deploying AI responsibly across the organisation. And as I said earlier, there's going to be a chance for questions at the end. So please feel free as we go along. If you think of questions, you can pop them in the chat and we will come to them at the end. So before I continue, we'd love to understand your feelings as a group on this topic. So if you're able to scan this QR code, please do, and give us your anonymous feedback as to what word comes to mind when you consider AI having a role in mental health support. There's also a link in the chat if you can't scan the QR code. So yeah, we would love to see the responses on that. So whilst you're doing that, I will just talk a little bit about who we are. Many of you are partners of ours, already work with us in some way, shape or form, so we'll already have a good idea of our origin story. But for those who don't, MHI was founded in 2017 following a grant from the Royal Foundation. And our mission is to contribute to the improvement of the UK's mental health by combining clinical expertise, data and insight, and technology. Shout was our first innovation, which is a 24/7 text-based, confidential and anonymous mental health support service. And since 2017, we've taken over 3 million conversations with over 1 million texters, giving that all essential in the moment mental health support. And this time last year, we proudly merged with the Mix, a fantastic charity that provides confidential support and information to under 25s. And that is done via social content, podcasts, discussion boards, counselling, and also self-paced tools. So let's have a look at your responses to the question. What word comes to mind when you consider AI having a role in mental health support? And I shall hand over to Fiona to talk about this and then go into her part of the presentation.
Thanks, Amy. It's actually, I've just been watching them come up on my phone and I can see them here. Yeah, I can see there are a lot of words around risk and confusion and caution, and it's absolutely understandable, concerning, but also, well, my word was potential. Yes, absolutely, it's complicated, but I think, yeah, there's an innovation there. I think there is, yeah, it's a really interesting area at the moment. If you want to go on to the next slide, Amy. I mean, this is a topic I think that we could talk for the whole session on, you know, chatbots and AI and mental health support. But I'm going to talk just on 2 slides, and really this is about what's going on in the mental health landscape, and it's a massive topic. And I think one of the main things is we know that there is a shortage of mental health support. There are long waiting lists. I'm sure we all know about this. And that we do need other ways that people can access support. The mental health chatbots, which is what I'll focus on, you know, there's a lot of potential there, as my word was, but there's also a lot of concern. And you probably would have picked up on a couple of the situations, cases, tragic situations of young people or people generally, all ages, who use mental health chatbots. And then, you know, we've had some really tragic outcomes. There's a recent one with OpenAI ChatGPT, and in terms of the loss of a young man and how his parents are now suing OpenAI. Interesting enough, they came out with a response, and I just jotted down some notes about it. One of the things they said was the need to improve how their models recognize and respond to signs of mental and emotional distress and connect people with care guided by expert input. So I think they recognize that there's because these chatbots often kind of are curious and want to explore, they can subtly reinforce what people are presenting. So they're talking about needing to have the chatbots to have the skill to de-escalate by grounding users in reality. And, you know, this is, of course, we know all about this because this is what we do in our mental health support on Shout in the Mix. So we know that there are a lot of challenges, and I guess I've gotten the last point there, the Wild West. So there's certainly the Wild West out there. You might have come across some of them, the chatbots that you can design any kind of avatar or chatbot that you want. You can get it to talk anywhere you want. There are big concerns about those sort of Wild West chatbots, but there are also increasingly expert curated chatbots. And we know that, for example, Ash, Therabot, and certainly if you look into ChatGPT, they're also talking about engaging with psychologists, psychiatrists, medical people, and those with experience working as we do, or young people as well, so that they can actually start to ensure that their chatbots are not, you know, they're not putting people at risk. However, I think it is a big challenge. The benefits, I would say, is that, you know, like our service is 24/7. You can reach out and have a conversation with a chatbot at any time. It certainly, I would think, fills gaps, which is what they are saying, that if used responsibly, it is promising in terms of filling the gaps. And one would hope that actually, and I know I've read up about how they are looking to do this, they're trying to actually ensure that people can, if they pick up risk that they can then connect them with emergency services. Like Find a Helpline, which is a global organization where they can refer you to that. You put in your country, it gives you all the contacts you need. That is in progress. So I guess, there are risks and there are benefits, and I guess where we're coming from is in the mental health field, it's not going away. So I think we need to call it out, the sort of progress and the development out, so that it doesn't leave people at risk, and that increasingly they are referred to emergency services if necessary, or other help or human support. So yeah, it's like watch the space, which seems to change every 24 hours, frankly. Next slide, please, Amy. I guess I wanted to put that against what we do. What do we provide that off-the-shelf generative AI tools can't? And I think it's sort of what I'm going to say qualifies what I said about the AI chatbots a little bit. I think when you contact for Shout or the Mix, you're in a communication with a person. It could be a trained volunteer, it could be a counselor, it could be a trained peer supporter, but you're in a relationship with a person, and we know across therapeutic approaches that the relationship is the most important thing. And it's funny, this morning I was talking to somebody about something. She was using Claude, Anthropic, and she was saying, I have to keep reminding myself I'm not talking to a person. So I think one part of that is the emotional attunement and validation that we do when you're talking to a person. It's training people to listen to the emotions, and often the emotions that aren't actually named, but they're certainly without texting, that they are inherent in the words that are being used. And I mean, that's a skill, really. And the issue with, I think, with ChatGPT and all the other AI chatbots is it's about that subtle reinforcement. If you've ever used them, you can find it'll agree with you, even if you tell it it's wrong. But the chatbots, it sort of agrees that it's wrong and then tries again. So the concern often is around that flattery and the fawning and the insincerity. And when you're talking to a human, well, we certainly train our volunteers to actually tune in and be honest and reflect in a really calm and supportive way. I think crisis intervention is a major thing when you're dealing with people, that we certainly at Shout, we can refer on to the emergency services, and we have that connection with them. And this is a big challenge with AI and with chatbots. Importantly for me, I think it's the clinical supervision and the moderation, that there are always people who are watching conversations. And I think that's one of the things that they are noticing with chatbots, that they need human oversight, and that's challenging, when you think about the enormity of it all. So that supervision and that moderation, post-conversation moderation even, safeguarding, all that sort of thing. The ethical and legal accountability. And I think for me also the social skills. We do know that, interacting with a chatbot may help people then go towards a pathway of talking to a person or going to see their doctor, and it's about developing those skills of how to have a conversation. I mean, one of the most used resources on our platform is, I forget what it's called, but about helping somebody design a conversation they can have with their doctor. What would you like to say? This is how you can say it, and then taking that off to their doctor, so they know how to do that socially and how to interact. And I think the last point I want to make is the mental health pathways. So certainly with the Mix and with Shout, we can help people access support, encouraging them to go to the doctor, putting them onto specialized websites where they can seek support for like anxiety. But the other thing that we often don't mention as much is that we are developing a professional mental health workforce by training people. And interestingly enough, people who use the service often come back as volunteers and train. So I think that's a very important part of what we do. I'm going to pass on to Melis now.
Thanks, Fiona. So as Fiona's just covered, generative AI holds a lot of promise, but also risks, especially in a mental health sport setting. And that's why it's so important for those of us who are developing this technology or applying it to do so in a way that's both ethical and responsible. So in line with this, one of the things that we have done is put together a set of guiding principles that informs all the work that we do as a data insights team. Now, you can read the full set of principles online, but I wanted to highlight 3 that I think capture some of the most important aspects of AI development. And just to be very, very clear here, when I'm talking about AI, I'm talking about it more broadly. I'm talking about machine learning algorithms. I'm talking about generative AI as well. So the first principle that we draw on at the earliest stages of any project development is proportionality. So deciding where these tools can actually be useful. Now, you may have noticed, but there is a lot of hype around AI at the moment. But we're mindful of the fact that this isn't always going to be the best solution. So what we try to do is to understand where it adds real value compared with other data science approaches. And we always try to prioritize high impact but low risk applications. Now, the second is collaboration. This is something that we also embrace when building our AI solutions. So we know that this technology works best when it's shaped by the people who will use them or be affected by them. So from the very beginning, we try to involve frontline staff, clinicians, volunteers, and other stakeholders, so often younger people, to ensure that the tools and metrics that we're developing meet their genuine needs. Quality here, I'm referring particularly to the outputs of the AI models, but I also think this is obviously like an important overarching theme that covers all aspects of the AI lifecycle. So we never really want to deploy and just forget about our models, right? Instead, we want to monitor their outputs over time. We want to gather user feedback, and we want to refine those models based on that feedback to continue to improve and ensure that they remain fit for purpose. So with that, we're going to cover a few concrete examples of how we use AI in practice. If we could just move on to the next slide, please. So as Amy mentioned earlier, the Mix's website is great. It provides a wide range of resources for young people, from articles on mental health and well-being through to services like one-to-one counseling, self-paced learning, and peer-to-peer discussion boards. And since 2022, visitors to this website have had the option to interact with the Mix bot, which is the Mix's dedicated chatbot that's been developed with a company called Future AI. Now, this chatbot helps people navigate our services and signpost them to both internal and external resources. Just to be very clear, this isn't currently based on generative AI, although the chatbot does use a little AI to interpret a user's query and then match it with the most appropriate pre-written answer in its database. Currently, the chatbot offers support on more than 300 topics, and that enables a young person interacting with it to quickly find the support and the information that they need. Since its launch, MixBot has supported around 13,500 people and answered over 27,000 questions. Now, I mentioned earlier about how we go through iterative cycles of improvement with our tools. So we periodically review the user interactions with the bot, and we continue to add new topics based on the kinds of queries that come up. And something that's kind of interesting to mention is some of our recent data has shown how some users are actually simply looking for a distraction when conversing with the MixBot rather than an answer to a specific query. And so we're currently working on pathways that offer resources to help distract a person or calm them in those moments. So for example, of offering grounding exercises or breathing exercises as well. So with that being said, I'm going to briefly hand over to Emilia, who will talk about how we use AI in monitoring aspects of the Shout service.
Thanks, Melis. So one of the main ways in which we routinely use AI and ML at Shout is for monitoring the quality of the service that we provide for our testers. So first and foremost, to identify any areas for improvements, we focus on the feedback our texters leave post-conversation. We use AI to analyze the contents of such feedback, which allows us to identify the main themes at scale. And the theme most relevant to today's topic is roboticism. So that's what I'm going to focus on, and I'll present a short case study of how we first used AI to identify the root cause of such complaints, and then how we capitalized on that to construct a continuous service monitoring and improvement system. So on that note, if you look in the top right corner, you can see a few message bubbles. These contain representative pieces of texter feedback that mention roboticism. As you can hopefully see, texters who report roboticism generally complain about their conversations feeling impersonal, scripted, hard to connect with, and oftentimes suspect that it was carried out by a bot, either in its entirety or perhaps with a human occasionally stepping in. These complaints amount up to 10% of all the negative feedback we receive, which makes them one of the key areas for service improvement. Now, if you turn your attention to the bar chart at the bottom, what this shows you is the percentages of the monthly percentage of conversations reported as robotic for each month spanning the time frame from the beginning of 2021 up until July this year. Around halfway through this graph, you'll see a green marker that denotes a particular time point of interest. That is December 2022, and that is the time where when ChatGPT was originally released for public release. So it was the very beginning of the public interacting with Gen AI models. And what you can see from this graph is that this time point also corresponds to a spike in the percentage of robotic feedback we received here at Shout. Now, a second observation you can make based on this plot is that in the time that followed, we see a slow but steady increase in the percentage of conversations being reported as robotic. And what this seems to suggest is that the roboticism theme that we see here at Shout seems to be tracking the rising public awareness of AI. And if I could go to the next slide, please. So given this last finding, we decided to test if the language used by Shout volunteers during robotic conversations might be in some way similar to the language used by LLMs and Gen AI models such as ChatGPT. To do that, we used a metric called perplexity, which measures how well an LLM is able to predict a given sequence of words. It's essentially a surprise score with low values, meaning that a passage of text is very predictable to the model, or in other words, that it sounds like something the model would say itself. So for our use case, we fed volunteer messages into different older generation LLM models and essentially asked them how surprised they were by each one. Interestingly, when we categorized conversations into robotic and non-robotic based on the feedback from our texters, and then compared the mean surprise scores between these two categories, we found that LLMs were significantly less surprised by the volunteer messages sent during robotic conversations. So this seems to suggest that the language used by robotic volunteers does in some way resemble that used by modern chatbots. In addition to this interesting insight, what this also allowed us to do is to give us a way of predicting whether a conversation would be judged as robotic based on its contents, which in turn allowed us to track this particular aspect of quality for all conversations and not just the ones for which the texter has left feedback. And we leveraged that to construct a human-in-the-loop feedback system where in the first step, we use AI to compute metrics such as these surprise scores, based on conversation contents. And in the second step, we rank conversations based on these metrics to prioritize them for human review. That's done by our volunteer support team, who then give any underperforming volunteers targeted feedback. So in summary, we can use AI to automatically flag conversations for human review, reducing and streamlining the workload for our volunteer support team and improving the service quality for our texters at the same time. And on that note, I'll hand over back to Melis.
Thanks, Emilia. So we wanted to highlight our first use case of generative AI. So this closely aligns to the type of AI that Fiona had mentioned earlier, where we're talking to a model or a large language model through a chat interface. And so this is born out of feedback from early volunteers who wanted the opportunity to practice the skills that they had learned through our Shout training before taking their first conversation, because this was quite an anxiety-inducing milestone for many of them. But we had a little bit of a dilemma in that we trained thousands of people each year, so it wasn't either feasible or scalable to offer human-led role-playing. So what we did is we partnered with Slingshot AI, and we built a generative AI application that's currently trained on 2 million aggregated and anonymized conversations. And so what this means is that it essentially simulates a texter that can discuss a range of topics like insomnia, like grief, and suicidal ideation, which often is a topic that texters come to us through Shout. So we're going to have a look at a demo of this now, of how the application works, and we're going to cover an insomnia example right now. So we begin with the user introducing themselves and asking an open question to learn more, to which the simulated texter responds that they're an unpaid carer and they're struggling financially. We're going to fast forward through the conversation a little bit. And we can see how through this interaction, the trainee has already been able to apply certain skills, making sure to set expectations about conversation time, beginning to explore the texter's issue, and also important for safeguarding, asking for name as well as age. However, sometimes the simulated texter does produce messages that don't entirely make sense, and in these circumstances, trainees are able to regenerate the message. So we're going to see an example of that here. And I'll go on in a minute as to why we're seeing scrubbed in those messages. All right, and trainees are regularly asked to provide feedback on the simulator. So it'll pop up like this, and then a slightly more detailed form appears. And once the trainee has had several exchanges with the simulator, they're able to submit the conversation for review. So this is where humans are kept in the loop. Our volunteer training team review the conversations and provide constructive feedback for the trainee to improve. Now, since launching in mid-2023, we've had more than 7,000 trainees use this application, with 86% of them reporting that it had helped them practice their skills. So it's already had quite an impact. So if we could just go to the next slide, please. All right, so as I mentioned before, user feedback continues to shape this application. And so one thing you may have noticed is those scrub messages. That is an obvious sort of reason that detracts from the experience of interacting with the simulator. And the reason why we see this in the first place is because the model has been trained on data that's been scrubbed of all personally identifiable information. So right now we're working on a fix with Slingshot to improve that. Another feedback that we've had is some trainees feel stuck on what to say. And so right now we're working on a second AI feature to be rolled out in this environment, which will show some example messages of how a trainee could reply. So sort of helping them to address that sense of being blocked and not being able to progress the conversation. Next slide, please. So that brings us to the end of this talk. So we hope that you come away feeling that you have a little bit of a better grasp of the current landscape, particularly around AI in the context of digital mental health support. We've covered how generative AI models and tools like ChatGPT may hold some promise, but these are emerging technologies and the risks need to be actively mitigated, right? Especially for vulnerable individuals. We've also seen how Shout and the Mix offer a number of advantages over current off-the-shelf generative AI tools, for instance, clinical supervision, as well as crisis intervention, which is so important, of course. And we've covered some examples of how we've been using AI at Mental Health Innovations, particularly when it comes to signposting resources, monitoring aspects of our service, and also in supporting volunteer training. So yeah, thank you, everyone. That brings us to the end.
Thank you everyone for your brilliant presentations, and I hope I hope the audience found that really interesting. We really enjoyed putting it together. So have we got any questions?
I think we've got one request to read out some examples of so I think if we go back a few slides, Amy, to the future development slide. Great. Sorry that it's so small, by the way, everyone. So yeah, these are just a few example messages. I'm not going to actually read them out. Perhaps I'll read one or two out. So I'm hearing you're feeling lonely tonight. You deserve to be supported. I'm here to listen. So the idea here would be to offer some suggestions that the trainee can use without encouraging them to directly copy and paste those messages, right? It would be a source of inspiration rather than, just outsourcing all of that, the responses to the model. But it's still a work in progress. And hopefully the next time we have one of these seminars, we'll be able to demo that to you live.
Brilliant, thank you.
There's a question around volunteers on the platform. Yes, there are always actual volunteers, and always behind the volunteers, there are always supervisors. There's always at least 2 during quiet times, but often more, I think up to 5 sometimes, depending how busy it is, and they can interact. Everybody can DM, the supervisors can DM their volunteers and vice versa, and then the supervisors can DM each other, so they'll consult with each other about decisions. They don't use AI prompts. However, there is a section on the platform where if they are thinking about what they can say, there is help with suggestions on the platform, and that's often used perhaps when volunteers are new, they're in their first 10 or 20 conversations. But obviously we want them to bring themselves into the conversation while still working within our model, which is primarily around de-escalation and then support if we can't.
There's also a question about how much negative feedback we receive. So that we receive predominantly positive feedback for 80% of conversations.
Brilliant, thank you. Sorry, I think my network froze there for a minute. Not helpful. I think we've got a hand up from Bridget. Bridget, did you want to ask something?
Yeah, I did. I was trying to phrase it in the chat, but I couldn't work out how to phrase it. I'm just interested in is there anything in the robotic volunteers sounding like the LLMs that is because they are using, for example, the example replies that you are sharing to learn from? Is there something about that in trying to help provide those examples that they can access them in order to sound more like might you be in a vicious cycle, I guess, is what I'm asking here.
So we've done a little bit of work on that post training. So once the volunteers are active on the platform, and it's more to do with the messages that Fiona just mentioned. So the kind of what volunteers can access during the conversation when they're feeling particularly stuck. So there's a list of example messages constructed by us that they can kind of fall back on when they're feeling particularly panicky, let's say. What we see is that the more they rely on those messages, the more robotic they are perceived. So that was one of the things we continuously track at the moment, and that gets fed back to our volunteer support team. We've also done a whole focus month in June, where we paired up with, again, volunteer support and the training team, and did a few videos and live sessions instructing volunteers how to, first of all, to try and not over rely on these example messages, and second of all, teaching them how to maybe be a bit more confident, and teaching them how to develop their own voice to use decisions.
Thanks.
Okay, I think that's it for questions, and we're sort of almost at 45 minutes now, so I think we'll probably leave it there. Thank you so much, everybody, for joining today. I hope you found it interesting and insightful. Any questions that pop up after this, please feel free to get in touch through our website. Yeah, and have a lovely afternoon.
Thanks, everyone.
Thank you,
Everybody.
everyone.